Ever watched your furry friend chase a ball or leap with joy? Now, imagine them struggling for every breath. Today, we dive deep into the world of respiratory distress in small animals. Let's help them breathe easier. Respiratory distress, in simple terms, is an animal's struggle to breathe. It's like trying to suck air through a tiny straw. Every breath becomes an exhausting effort. In our pets, it's not just about feeling out of breath after a sprint. It's a serious signal that something's not right internally. Whether it's a blockage, inflammation, or a disease, it's critical we recognize and act upon these signs. When we say respiratory distress, we're talking about an interruption in the smooth flow of air in and out of the lungs. Picture healthy lungs as soft, expandable balloons, filling up and emptying out effortlessly. Now, in distress, these balloons face hurdles, making every breath a challenge. Alright, let's unravel the mysteries behind what causes our little companions to face such breathing troubles. First on the list is the upper airway obstruction. Imagine a hosepipe. If there's a blockage at the mouth, water can't flow freely. Similarly, obstructions like foreign bodies or swellings can hinder air passage. Next, we have lower airway disease. This is deeper within the respiratory system, affecting the tubes or bronchi. Think of it as small twigs stemming from a tree's main trunk, getting inflamed or constricted. Moving on to parenchymal disease. The lungs, which are like sponges, can sometimes get filled with fluid or get inflamed, making it difficult for them to expand and contract. Pleural space disease is another culprit. The lungs are encased in a thin space called the pleural cavity. If this space fills with fluid or air, it can compress the lungs, making breathing laborious. Lastly, vascular disease. Our pets' lungs have a network of blood vessels. Any issues here, like clots, can disrupt the oxygen-carbon dioxide exchange, which is vital for life. Understanding these causes is our first step in ensuring our pets' well-being. Because, as they say, knowledge is the first line of defense. Now that we're familiar with the causes, it's time to sharpen our eyes and ears for the warning bells. Recognizing respiratory distress early can be the difference between a quick recovery and a severe health crisis for our furry friends. First up, open mouth breathing. While it might be typical for dogs to pant after play, cats usually breathe through their noses. So, if you see a cat breathing with its mouth open, it's a sign they're working hard to get air. Next, observe the chest and abdomen. If they're moving more than usual or in a synchronized pattern, that's not a good sign. It's as if they're using their belly muscles to help with breathing. Cyanosis or bluish gums is a major red flag. It means there's not enough oxygen circulating in the body. Healthy gums should be a nice pink. Also, an increased respiratory rate, even while resting, is alarming. It's like they're running a marathon without moving an inch. Other signs include coughing, wheezing, or a change in their vocal sounds. Always trust your instincts. If something feels off, it probably is. Remember, our pets can't tell us they're in pain, but with our keen observation and quick action, we can ensure they get the care they need. Spotting the signs is just the beginning. To truly get to the root of the problem, a thorough diagnostic approach is essential. Think of it as being a detective, piecing together clues to solve the mystery of our pet's distress. The cornerstone of any diagnosis? A physical examination. By listening to the lungs with a stethoscope, Vets can pick up on abnormal sounds, like wheezing or crackles. Just this simple tool can give a wealth of information. Next, X-rays or radiographs are invaluable. They provide a snapshot of the lungs and chest, revealing any blockages, fluid buildup, or structural abnormalities. It's like having X-ray vision into our pet's body. Blood tests are another piece of the puzzle. They can indicate if there's an infection, inflammation, or even a clotting disorder. Blood can tell tales, and these tales can guide treatment. Sometimes, more advanced techniques like ultrasound or bronchoscopy, which is a camera down the airways, might be needed for a clearer picture. In the world of veterinary medicine, swift and accurate diagnosis is paramount. Because the faster we find the problem, the quicker our pets can be on the road to recovery. Once we've pinpointed the issue, it's all hands on deck to stabilize and treat our four-legged patients. But remember, every case is unique, so treatments can vary. First and foremost, stabilization is crucial. Before diving into detailed treatments, we need to ensure the patient is stable. This might mean providing supplemental oxygen, especially if they're struggling to breathe. Think of it as giving them a breath of fresh, revitalizing air. Oxygen therapy is often the go-to, especially in severe cases. By increasing the oxygen levels, we're giving the lungs and body a much-needed boost. Picture it as a lifeline, ensuring every cell gets the oxygen it craves. For those with fluid buildup, diuretics might be prescribed. These help expel excess fluid, alleviating pressure on the lungs. It's like wringing out a wet sponge, allowing it to soak up fresh air better. Sedation can also play a role. If our pets are overly anxious or stressed, sedatives can help calm them down, making breathing easier. And in some cases, fluid therapy, antibiotics, or even surgery might be the best course of action. But no matter the treatment, the end goal is the same: to help our pets breathe easy and enjoy their playful, vibrant lives. With the right care and attention, we can turn those distressed whimpers into joyful barks and purrs. Now, let's test your newfound knowledge. Quick question. For all you budding vets and animal lovers, what's the primary treatment for an animal in severe respiratory distress? Think fast. That's right, it's oxygen therapy. Giving them that essential breath of fresh air can be a game changer. Well done to those who got it. And if you didn't, no worries. Every day is a learning opportunity. Drop your answers in the comments, and let's keep the conversation going. As we wrap up, remember our pets rely on us to be their voice, their advocate. Recognizing respiratory distress and understanding its intricacies can make all the difference. Whether you're a seasoned vet, an aspiring student, or a loving pet owner, your vigilance can save lives. So, let's pledge to always stay observant, always stay informed, and always put our pets' well-being first. If you found this information helpful, share it with others in the community. Together, we can create a world where every breath counts.